So people always ask me questions, when can I ... When can I stop wearing garments? That is a really personal choice. In general, I like people to wear garments for sure for the first 2 to 3 weeks because you're swollen and bruised, and that's when you really need it for the healing from surgery. But as you get farther out, it becomes a little bit more of a comfort thing. If you're still swollen, if you're still bruised, if you still have pain, that's your body saying, I'm not healed yet. And so supporting it is going to help you. If you are a typical Bay Area person who is an Energizer bunny rabbit running in 40 different directions, you're active. And so giving yourself some support is going to help you not swell and bruise as much. It's going to help if your nerves are waking up and they're a little irritable. It's going to help tap that down. And so it's really a supportive thing. Again, it isn't shaping you. It isn't doing anything from that perspective. There's no downside to doing it. So if it makes you feel better, some of my tummy tuck patients, there's some numbness that you have, and sometimes that just feels kind of weird, and they feel more secure with wearing a garment. Go for it. There's no downside to doing that. As far as when can I exercise? That's a super common question. Everyone is a little different. Short answer is usually around a month out. You can do almost anything for almost every surgery, but there's a but. And the but is, how are you healing? And so when you come into clinic, I am assessing every time you come in, how swollen are you, how much pain do you have, and how much bruising do you have? If I have a patient who comes in and they are a week out and they still have some dark bruising, that tells me they're healing more slowly or they're being active. So just if you want to know if I'll know if you're cheating, I will. Just like you know when your kids are doing things, it's pattern recognition and I know where you should be. And simple things that you wouldn't think of as being exercise. I had one patient who said, but I stayed on the flat parts of the hike. That's lovely, but that's still exercise. So you need to wear the garments until you get to a place where you're not having that. And that's a little different for everyone. There are things you can do to help with swelling and bruising. Arnica, bromelain, wearing your compression garments, actually taking it easy and not being up on your feet and doing all those things. But there's some of it that's just individual and everyone's just a little different. So not to sound too Californian, but I've lived here for a long time, so I guess I can. You need to just listen to your body. So if it still feels achy, if you have bruising, if you have swelling, that's your body telling you to take it easy.